Hello, I'm Brenda Schivito, and this is You Are Not Alone, the show for news, tips, and stories of hope for those struggling from the disease of addiction. When we think of the DEA, the Drug Enforcement Agency, many of us think of the men and women suited up in bulletproof gear, storming buildings to apprehend the bad guys who are selling drugs illegally. Well, that would be a clear visual, but that's not all they do. There are many areas of the DEA at the local and federal levels. Joining me today are DEA agents Frank McCarthy and Andrew Eiseman. I had the privilege of meeting them both at the Family Opioid Summit in Washington, D.C. They currently work at the Philadelphia Field Division Community Outreach Department. I'm excited that they can be here today to discuss their roles at the local level and discuss the role of the DEA at the federal level. Thank you, Frank and Andy, for joining me today on You Are Not Alone. I'm so happy to have you both with us today.
Our pleasure. Thank you for having us.
This is great.
And thank you for the work that you do.
Oh, thank you for all that you guys do. Just real quick, though, to give people an idea about what you do, can you provide us with what your roles have been throughout the DEA?
Sure. In my particular situation, I started with DEA in 2010 as a financial analyst. The role of community outreach, that position opened up, and I was fortunate enough to be considered for it, which I did. And the reason why DEA felt it really important to start getting out into the community was the mere fact that the community at large needed to be educated, taught about, and brought up to speed with different things that are going on as far as illicit drugs are concerned. So I started, I guess, in 2017, and that is when it was like the end of the prescription opioid crises, which, as you know, quickly morphed into the heroin issue, and then fentanyl, and now fake pills.
Mm-hmm. So how long have you been with the DEA total?
Since 2010.
Okay, great. Yeah. How about you, Andy?
Well, my career with DEA started back in 1988 when I was hired as a special agent. And I worked with DEA up until 2014, and I retired as a supervisory special agent out of Detroit, Michigan. Born and raised in Philadelphia. My son decided that he was going to go to Temple University, so we're like, good excuse, let's go back to Philadelphia. Okay. After I retired, I did a couple things here and there, and then an opportunity came up to go back to DEA as a contractor to work in community outreach. Community outreach to me is so very important. In my last position with DEA, I oversaw the demand reduction program in the Detroit Field Division. Yeah, I am passionate about it. I think it's so very, very important. And when the opportunity came up to go back, not only to DEA, but to my home, I felt it was something that I needed to do. I've been working with Frank for the last 2 years, time flies, in this very, super important mission of community outreach. And I couldn't be happier. So my career with DEA continues.
That's great. That's good. And so let's just move into a little bit and talk maybe just a few minutes about the timeline, the inception, what happened with oxycodone for anybody who may not be familiar, and how that morphed into where we are today.
Yeah, it's been a rapid change. The landscape has changed rapidly. And like I said, when I began community outreach, the focus was on those prescription opioids and educating the public, making them aware of how addictive they were, trying to bring an understanding to the subject of addiction and how that is not just a choice and should not be judged as a moral failure, but indeed truly a disease. But like I said, that has changed pretty rapidly. And I remember very shortly after we started the program focusing on prescription opioids, changes started to occur in prescribing practices, leaving a lot of people in a situation where they had a need to be filled and therefore would turn to heroin, which was more available, which was cheaper, and highly, highly addictive. Okay. Then before I knew it, you were hearing reports of fentanyl, and fentanyl being in heroin. And shortly after that, it replaced heroin.
And then, so people understand we're not medical professionals, but fentanyl is legally used in hospitals under supervision.
Absolutely.
So we know oxycodone.
It is a good drug. I mean, for
is,
people suffering extreme pain.
Right. There are, when a doctor is prescribing it and monitoring it in the hospital.
And I think that's an extremely important point. Because fentanyl given properly is an extremely useful drug. It's an important drug for people in end-stage cancer, very pain. But it is manufactured in a regulated environment. Not in the jungles in Mexico. So that's one of the things that, as part of Frank and I have to go out and say, like, look, you're not getting what you think you're getting.
Right.
Yeah, the fentanyl on the street is synthetic, it's man-made. Fentanyl is very easy to produce. As opposed to heroin where you need acreage and land to grow it, fentanyl, you don't need any of those things. So there's two different types of fentanyl. Unfortunately, the fentanyl that's being made by people that do not have a background in chemistry or have no abilities to make a drug are making it. And therefore, very inconsistent. It's the wrong amounts that are in the fentanyl that's leading to a lot of different types of deaths.
Right. So brings us to where we are today with your roles, dealing with this terrible travesty that we have going on in our communities and in our country. The statistics are staggering. And so your roles in this are to
with community outreach, with DEA, we have enforcement, obviously, that deals with the cartels, that deals with battling, having drugs come into the country and land on our streets. That battle is huge. And the other part of DEA deals with the registrant personnel, people who prescribe, controlled substances, overseeing that, making sure we have the right amount of drugs available to consumers, and at the same time making sure people are prescribing properly. The final piece is Andy and I, community outreach. Our focus is demand reduction through drug prevention education. Andy and I make up the community outreach team for Philadelphia Field Division, which covers all of Pennsylvania and Delaware. So there's a lot of turf to cover. However, we are both passionate, and it's really, really important that we get the word out to all audiences, but especially our youth, concerning the dangers that are out there. It has changed dramatically from the types of drugs that are out there and how toxic they are, to the accessibility, how easy they are to get offline. A lot of people are unaware of that. So the risks are increasingly higher. And finally, people of all ages need to understand you cannot get a prescription drug online, okay, and think that it's legitimate. A lot of people think they can buy anything online. However, when it comes to medicines, prescriptions, that has to be issued by a doctor and filled by a pharmacist. But a lot of college kids think, I can order it offline, and that's what they do, and they end up with a problem.
Or they can get it from their friends. Their friends, I got to study, I need, got any Ritalin, you got any Adderall, which we know are stimulants for the brain to focus. And I think that's really out there a lot amongst our youth and college students. And they'll say, here, I got something for you. And doesn't have your name on it, is not your prescribing doctor. And to your point, I think a lot of people, you don't know where it's coming from. And talk a little bit about the accessibility and what's being done. I mean, when you say accessibility online, I mean, Instagram, TikTok.
All those platforms. And I know that there's certain legislations that are trying to move forward in safeguarding kids, but that's not happening right now. And again, accessibility, kids can get it very easily. They can get it delivered to their home. Heard so many different stories about kids naively thinking that it was a Percocet or something legitimate and ended up dying as a result because it wasn't legitimate. It was a fentanyl fake pill.
One of the things that Frank and I talk about is when we were growing up, you may have a drug dealer on the corner who knew all their clientele. They had 15 or 20 people that would come by. You know them by name, maybe even a friend. You never know. Now you just need this, and this will get you access to thousands of dealers across, and they're nameless, they're faceless, they change. And we're finding that daily we're talking to parents as well. He got it on Snapchat or Instagram, and it was there, and it wasn't what he thought it was, and that's what's happening.
So tell us a little bit specifically about the programs that you're involved with. What is it that you actually are doing?
That's a great question. We're very busy. We have a lot of different programs that are annual programs that are pretty much DEA favorites. But we also have been working with different types of groups, everything from a senior citizen center to a red ribbon event at a school on Friday, to working with community partners in different sections of the city in trying to raise awareness and focus in on prevention.
So you say elderly, you say?
Yeah.
Okay, expand on that.
Sure. We just had our National Take Back, which is a semi-annual event. And a lot of times, senior citizens are prescribed a lot of different medications and don't realize that these medications could be diverted and used by members of their family or neighbors or whatever, and often don't know how to get rid of them. So it's a program to safely dispose of unused prescription medications, which a lot of senior citizens are concerned about and find it beneficial.
And sometimes they can't always have access, because I know some of the drugstores in our area will have disposal boxes, but sometimes these seniors can't get to those outlets to do that. I know at my church, I just started doing that every 6 months. We have the sheriff's department come in to dispose of people's unwanted, expired, unused medications safely.
And that's a great program that everybody can participate in. Okay. Also finding that and speaking to that, the older senior citizens, a lot of them have experienced the issue firsthand with a child or grandchild. This situation has impacted so many different families, and many people want more information and want to see what they can do to help. Yeah, which is great. So talk about Red Ribbon. Red Ribbon, that was held in October. Andy, do you want to talk about?
Red Ribbon just it memorializes Kiki Camarena, who was killed by drug traffickers, and this is in remembrance of him, but it also brings awareness to everyone about drug prevention. We're in schools, we do a Red Ribbon Pledge that we talk to the kids about, we do different events, but it's something just to highlight Kiki, but keep his memory alive, but also just ensure that kids understand what's going on. And that's really where we get to speak to kids of younger ages, which is great, because we speak from kids from kindergarten through college, there's never an age where we don't like to speak to the kids. Our message is, of course, the same but different, because we have to talk to kids. The audience, tailor it to the audiences. But Red Ribbon is special to me because I came on the job just a few years after Kiki was killed. He was tortured and killed by the cartel in Mexico, and that kind of started where we are, today, especially with outreach, which is so very important.
The kids we spoke to on Friday, they were 5th grade. And in my opinion, that is a very good age to have this conversation, because they're old enough to have a general idea of what's going on, but still very open to hearing the facts. And they asked tremendously wonderful questions. Were very curious, and
they're very honest.
I think they were impacted by the fact of, you don't want to get involved with drugs because what it does to your mind and your body and your future. So
one of the kids we had probably maybe 100,
Yeah.
125 kids that were around, and they're in the auditorium. And it's always funny, the questions that you get asked. And Frank was walking around, the kids were all asking their hands. There's a little girl to my left. And I looked over and she's like, oh, son. She goes, I go, what's the matter? She goes, I have a question. And I said, well, what's your question? And she said, I learned about marijuana. I learned about the pills we never can take from anyone but our mom. And she goes, are there any other drugs I have to worry about?
Wow.
And I said, well, and I was talking a little bit about this and she goes, there's so much I have to learn. And it was to me, it was like, okay, she's getting it. You know, she's inquisitive and she's asking the question. So that always makes our day when we talk to kids.
Yeah, sure. And that they're listening.
Absolutely.
And they're not just turning you off and, you know, and sleeping and nodding off and saying, well, when's this going to be over? So was this in a school atmosphere?
Yeah, it was in a school atmosphere. Okay. October has been very busy. And you had mentioned that we met at the Family Summit in headquarters last year in D.C. Again, they had a Family Summit in Washington, D.C. And Andy and I coordinated a family summit for the Philadelphia division. Right. This is a very special group. This is a group of people that have lost children as a result of substance use disorder. These people are people that will bring home to me why I do what I do. As a parent, as a grandparent, I can't imagine the loss of a child. And all of these people hurt tremendously. And I admire, because so many of them work towards causes that make it better for others and to help families and kids avoid death or overdose.
And I think it's so important that Frank and I know will echo this, and it's something that we talked about, especially after the first family summit, that this tragic epidemic that we're going through now, it's not only claiming lives, but it's bringing out unwitting advocates like yourself, that it's so important for people to hear these stories. We had the pleasure of you coming once to one of our schools, and I can't tell you the impact that it made when they hear from a parent, because from two old guys standing up there, it's like, oh, what are you guys, whatever.
Depends on your audience, age group, right?
But you hear it from someone who went through it, and there can't be anything more powerful to bring that point across. So I know we want to thank you for doing that, and we've made so many friends doing the family summits, and the stories are so powerful, and it's just important that you get the message out there, because I know the last thing you want to be doing is advocating this for the reason. Absolutely. So we really appreciate that.
And one last thing, Andy and I have the ability to learn from our audiences 100%. As well. And we learn so much from that group of parents and family members that have lost someone. Everything from, understanding it, the importance of removing stigma, to really try to explain to our audiences what substance use disorder is, so there's an understanding, even down to language and making sure people are sensitive to what terms they use, which is extremely important.
Right. Do you see the stigma diminishing at all? Do you think it's?
Yeah, I think there is much more of an understanding than there was when I started in 2017. Of course, it's still out there. There's still people that don't understand. But more people are sensitive to it. And I think only because they know someone that has been through it personally, or they've spoken to someone, which enlightens people to the reality, that... So.
And it's touched so many people. I don't think there's any place or anywhere we've ever been that some form of substance use disorder hasn't touched the family. I mean, I've experienced it. Frank has experienced it. Everywhere we go and we say, "Has anyone?" and everyone raises their hands, and it's just part of what's happening.
And
now.
it's out there, and it's not going away, unfortunately. And it's something that, what we've talked about is the education piece, and, helping people to understand and I can't stress it enough, I always say it, the disease of addiction, and changing that narrative to reflect it as a disease.
Correct.
So out of this, you have the One Pill Can Kill campaign. Talk about that a little bit.
That was a campaign that started in the fall of 2020, Andy? 2019.
When the alert came out,
When DEA was finding a lot of fentanyl in fake prescription pills, okay? At that time, it was 4 out of 10, which was very alarming. About a year later, it went up to 6 out of 10. Just recently, we had to adjust that to 7 out of 10 pills, okay? Wow. And locally in the Philadelphia area, it's leaning more towards 8 out of 10. That's a high risk for a kid. If you lay 10 pills in front of him and he only has 2 that may be safe and the 8 are going to kill him. You know, so that One Pill Can Kill campaign is to raise this awareness of what's out there, that you cannot get a prescription drug, no matter even if it looks exactly like the prescription drug you're after, and know for sure that it's a real pill.
Exactly. And to make it clear, what Frank is saying is, and again, when we go out and speak to our audiences, it's so important to drive it home that if you get a pill from anywhere outside of the pharmacy, the doctor, the school nurse, your parents, it's going to be fake. I mean, I can't stress that enough. I mean, you have better odds playing Russian roulette than you do buying a pill off the street. And it only takes 2 milligrams of fentanyl to do that. 2 milligrams fits on the tip of a pencil. We talk about people making these fake pills. They have no idea what they are doing. All they're doing is they're throwing in this batch. The average amount of fentanyl that is seized in a pill is 2.4 milligrams. What that means is, of all the pills that DEA and its law enforcement partners seize, the average amount is enough to kill someone. So, I mean, this is something that I spent 3 years in Bogota, Colombia. There was a guy down there named Pablo Escobar when I was there. This is worse than I've ever seen. And I've seen it all. I mean, I can actually say I'm that guy that's been through it and seen it all. This, what is happening now, is worse than, and that's one of the reasons why I came back, honestly. It's like to try to inform people and ensure that they understand what's going on. And I think Franco would echo that. We're seeing it from middle school through high school. These kids that are getting these pills, they have no idea. It's like ordering a pizza. You know, I'm studying for a test. Let me order some Ritalin. Oh, my back hurts. Let me get a Percocet or a Percodan. And 10 minutes later, it's at the door, and here's your pills. And you're just rolling the dice.
Do you think, I mean, this may not have anything to do with DA. Do you think the medical community is becoming more aware of their prescribing and the whole fake versus the true? And
yeah, I do believe there's a raised awareness in the medical community, and I need to commend the medical community. They spoke at at the Family Summit in Philadelphia, and how they have taken on new approaches towards treatment, towards education, and working together. Andy and I being prevention people, working with recovery and treatment, different lanes, but towards the same problem, really benefits everyone, especially the community.
So you mentioned medical. So, you know, in Philadelphia, it was somebody spoke, I think Penn and Jeff, I think some of those major hospitals are becoming more aware and engaged in this community.
Jefferson Hospital actually spoke at our event. And they shared with the audience their approaches, what they do, what changes have occurred, you know, from 5-6 years ago. So there's a much more heightened level of sensitivity and care and understanding the whole situation.
And I think for law enforcement too,
even
on the local level, I think this is a new training, you know, curve of learning where, you know, we have police who are not mental health or substance abuse specialists. And I think there's a whole nother group of people who need to come into this. And I think they are slowly.
And on the kind of with that, we get calls from Jefferson Hospital or different hospitals. Can you come speak to our doctors and our nurses to explain what you're seeing out there.
Right.
So we
That's
then
great.
can be more aware. And it's a great partnership there too, because
That's great.
sometimes they'll call us and say, are you seeing this? Or is this going on? And it's very beneficial on both ends.
It
That's
is.
great. We all have to collaborate.
Absolutely.
Yeah, partnerships and raising awareness.
Well, it's like Frank and I are two people. When I was with DEA, DEA is a relatively small law enforcement entity compared to other federal entities, right?
Right.
So we need those force multipliers to take effect.
Right.
And that's important. That's why it's so important for everyone we talk to spread the word.
Sure, in every avenue. And I have to say, when I was down at the summit, I really give the DEA a lot of credit because they do recognize those that we've lost. Those lost to fentanyl, the wall of all of our loved ones. And I think you could speak to that too, as the agents.
Yeah, Ann Milgram, who is the administrator, has taken on a crusade to raise awareness, not only amongst the staff at DEA, but the community as well. Again, these stories, these pictures drive home the reality that we're losing people very quickly, and in some cases very needlessly. It really, community outreach is high on her agenda of goals. It's an enormous problem, drug trafficking, and DEA has a tremendous fight on its hands. But I can tell you, I work with a lot of really wonderful people. Never give up, continuously trying to make it better.
Right. And that wall represents people of all ages. I think the youngest one is under a year, I want to say. It goes through, through their 30s and 40s and 50s. So when we say it affects everyone, it affects everyone.
And every community.
Every community. No one is immune to this.
Right?
No.
Everybody from Philly to Wayne to Radnor to Westchester and
to the farmlands of Lancaster. It's everywhere.
It's everywhere. So for people to think that it's not happening in my backyard or my community, we live in a safe place. I thought we lived in a safe place too. And we do live in a safe place, I have to say, in Westchester.
But you can't stick your head in the sand because otherwise it'll just pass you by, and we don't want that.
No, we don't. Well, I think we could probably agree that we could probably sit here for another hour and just talk about this topic. But you guys have been great to come out, and this has been really informative. And if anybody wants more information from the DEA outreach or want to get in contact with you, how would they get in touch with you?
They can call me or email me. My name again, Frank McCartney, McCartney. My email is frank.j.mccartney@dea.gov. Cell phone 267-990-2459. And again, we can come out and speak to a group. We can answer questions. We're happy to, if you already have a drug prevention program in place, we can add to it. We can support it. Whatever you need us to do, we're available.
We're just so grateful for people like you, and because of the programs that we're doing now, we get to meet a lot of people, and we just really appreciate everything that you do, Brenda.
Well, I appreciate you guys because I know you carry a deep-rooted passion for this.
Yes.
And it's so evident, and I couldn't, thank you guys enough for coming on.
Our pleasure.
Thank you.
Well, thank you for joining us for this important discussion. I hope that you've gained more insight about what the DEA is doing in our community and at the federal level. They play an important role in helping to reduce substance-related deaths and are truly passionate about what they do. On another note, I'm happy and excited to announce that Narcan, or naloxone, is now available over the counter at your local pharmacy. Please get trained in how to administer this life-saving nasal spray. Personally, I never leave home without it. And if you or a loved one needs help or would like to donate, please visit us anytime at angelsagainstaddiction.org. Remember, you are not alone. And I believe together we can help save lives. Thank you.